vaccine may be linked to at least 10 child deaths.
Well, Chris, it's important for us to look at the data. They didn't, exactly as you said in the tee-up, they provided no actual evidence for us to look at. So curious to see what evidence they provide to back up that claim, because a lot of the quotations and headlines coming out of that memo seemed intended to get a headline and to say something really astonishing and attention-grabbing. What concerns me is that, time and time again from RFK and his deputies is a consistent understatement of what COVID actually does to our bodies, and especially the bodies of children. And, don't take my word for it. Don't take my colleagues' word for it. Look at the best evidence. We just had a big clinical research study published in The Lancet, one of the world's leading medical journals, showcasing that the risk of infection to children causing clots, causing other inflammatory processes in the body can last for up to a year after a diagnosis of COVID in a child, 5 months to 18 years of age, versus that risk from the vaccine, far less. But we don't talk about that. We don't hear them talking about that.
And that's actually a verified study. So as I mentioned, Vin, the FDA is now proposing changes to how the agency evaluates vaccine. What might be the real world impact on public health?
Well, let's take the flu vaccine, Chris, for example. And just a CDC estimates last year suggested 120,000 hospitalizations across the United States were averted because of the flu vaccine. That's a big deal for those of us that practice in an intensive care unit. Where are these patients going to go? Otherwise, more and more patients will flood hospitals. So that's the real world impact. When you dive into the memo, again, raising more questions, what do they mean? They want more, quote unquote, more evidence on real world outcomes.